Today we are going to talk about anthelmintics. Worm infestation are more common in the developing countries. It is seen in people with a poor hygiene. And these anthelmintics are also called as the deworming agents. Right? These worm infestations are more common in the developing countries because of poor sanitization or poor hygiene, and these antihelminths are also called as the deworming agents. Basically, there are two types: vermicidal and vermifuge. Vermicidal means those who kill the worms. Vermicidal means those who kill the worms, and vermifuge means those who promote expulsion of worms from the body. So we have vermicides and vermifuges. Several deworming agents are now available, and it is possible to treat many worm infestations successfully. Now in that category we have benzimidazole. This benzimidazole includes thiabendazole, mebendazole and albendazole. Thiabendazole is the first agent of this group, which was discovered in 1961. But now the newer ones like mebendazole and albendazole are commonly used because of milder toxicity and better antihelminth effect. We use the albendazole and mebendazole also, but albendazole is most commonly used drug. Now we'll see first the mebendazole. It's a broad spectrum, wider spectrum, and it cure almost all the worms like roundworm, hookworm, pinworm, and also the strongylites infestation. The eggs and larvae are also destroyed. The eggs and larvae both are destroyed by this mebendazole. The dead parasites are slowly expelled from the gut over the several days. Means that dead parasites or that dead worms that will get slowly expelled from the gut over the several days, or you can use the purgatives for the removal of these dead parasites from the body. Now, by which mechanism they act, or what is the mechanism of action of this benzimidazole, mebendazole, albendazole, all they are having a similar action. So where they bind, these drugs binds to the beta tubulin of the parasites. Where they bind to the beta tubulin, and they inhibit the synthesis of microtubule, and these microtubules are necessary for various metabolic processes of the worms or parasites. And if they inhibit these microtubules, there is the occurrence of parasite death. Apart from binding with beta tubulin, they also decrease the glucose uptake in the parasites. They also lead to the parasite death. Means by acting on two different sites, means they will bind to the beta tubulin of the parasites, and that's how they inhibit the synthesis of microtubule, and they also decrease the glucose uptake in the parasites. Ultimately, there is the death of worms or parasites. Now pharmacokinetic properties. This mebendazole is poorly absorbed, 10 to 20% from the gut, and also undergoes first pass metabolism. Fatty food enhances the absorption of mebendazole. It is extensively bound to the plasma protein, and it is metabolized by the liver. Dose is 100 mg thrice a day for 3 days, or 500 mg single dose. The various brand names that we know: Mebex, Mebazole, Helminthol, 100 mg tab is available. You can mostly, it is given 3 times a day or twice a day, or 500 mg single dose. Then what are the adverse effects of this mebendazole? It is well tolerated. Nausea, abdominal pain, diarrhea may be seen in heavy infestation. When we have very means severe infestation, hookworm infestation, roundworm infestation, in that case nausea, abdominal pain and diarrhea, means GI symptoms will be there. Large doses may cause headache, dizziness, loss of hair, granulocytopenia. Rarely it may provoke abnormal migration of roundworms, which may come out through the mouth and nose. Means it is very rare. But sometimes because of this drug, that worms may come out through some different orifice like mouth or nose, but it's very rare. And this drug should be avoided in pregnancy and children less than 2 years of age. Mebendazole, it should be avoided in pregnancy and children less than 2 years of age. So where we can use this mebendazole? in the treatment of roundworm, hookworm, pinworm, tapeworm, trichiuresis, hydatid disease. Means it is of special value in multiple worm infestation. Mebendazole is used in the treatment of roundworm, hookworm, pinworm, tapeworm, trichiuresis and hydatid disease. Or we can say that it is of special value in multiple worm infestation. When we have multiple worm like roundworm, hookworm together, so it is of special value. Okay.